In a world that's no stranger to the challenges posed by emerging diseases, today, we dive deep into a topic of great significance, the Nipah virus. Over the past few years, we've witnessed the global impact of COVID-19, but there are other viruses out there that also demand our attention. Nipah virus is one such virus, and in this video, we're going to explore its origins, symptoms, prevention strategies, and even draw some comparisons with COVID-19. But before we dive into the specifics, let's take a moment to understand why studying diseases like Nipah is crucial. Emerging diseases, like Nipah, remind us that our interactions with the natural world can have profound consequences. These diseases often originate from animals and can rapidly spread among humans. Nipah virus, in particular, has a fascinating history, and understanding it is not only about knowledge but also about taking precautions to protect ourselves and our communities. So, join us on this journey to explore the mysteries of Nipah virus, compare it with COVID-19, and learn how we can work together to prevent its spread. In the following sections, we'll delve into the specifics, starting with what exactly Nipah virus is and how it differs from COVID-19. Stay tuned as we unravel the story of Nipah virus, and please remember to subscribe and hit that notification bell so you won't miss any of our updates. Now that we have a grasp of what Nipah virus is, let's dive into detailed video, Nipah virus versus COVID-19. It's essential to understand the differences between these two viral threats. First, let's start with the basics. How do Nipah virus and COVID-19 compare in terms of transmission and origin? Nipah virus is primarily transmitted to humans from animals, often through the consumption of contaminated food or direct contact with infected animals. In contrast, COVID-19 is mainly transmitted through respiratory droplets when an infected person coughs, sneezes, or talks. It's primarily human-to-human transmission. Now, let's talk about their geographical reach. Nipah virus outbreaks have occurred mainly in South and Southeast Asia, with a few isolated cases reported elsewhere. It's relatively rare but potentially deadly. COVID-19, on the other hand, has shaken the world, leading to a global pandemic. It's affected nearly every corner of the globe, with millions of cases and fatalities. When it comes to the severity of symptoms, Nipah virus can lead to a range of symptoms, from mild flu-like symptoms to severe encephalitis, affecting the brain. COVID-19 can also vary in severity, but it's typically characterized by respiratory symptoms, with severe cases leading to pneumonia and sometimes death. In terms of the overall impact on healthcare systems and economies, COVID-19 has had a far-reaching and long-lasting effect. Nipah virus, while serious, has been contained more effectively due to its limited spread. But it's crucial to remember that every outbreak teaches us valuable lessons about preparedness and response. So, in summary, while both Nipah virus and COVID-19 are viral diseases with their own unique characteristics, COVID-19 has had a much more significant global impact due to its rapid transmission and widespread presence. In the upcoming sections, we'll explore the specific symptoms of Nipah virus, prevention strategies, and much more. Stay with us on this journey of discovery and awareness. Don't forget to like, share, and subscribe to our channel for more valuable insights. The symptoms of Nipah virus. Understanding these symptoms is crucial for early detection and prevention. Nipah virus infection can manifest in various ways, and it often progresses in stages. Let's break it down. In the initial stage, which typically occurs 3 to 14 days after exposure, individuals may experience symptoms similar to the flu. This includes a high fever, severe headache, and muscle pain. These symptoms are nonspecific and can be easily mistaken for other common illnesses. As the infection progresses, some individuals may develop respiratory symptoms such as cough, sore throat, and difficulty breathing. What sets Nipah virus apart is its tendency to cause gastrointestinal symptoms. These can include vomiting, abdominal pain, and diarrhea. But here's where it gets concerning. In severe cases, Nipah virus can progress to the central nervous system, leading to encephalitis. Encephalitis is inflammation of the brain, and it can result in altered consciousness, confusion, seizures, and even coma. Sadly, the progression to encephalitis often leads to a high mortality rate, with some outbreaks reporting fatalities in over 70% of cases. For those who do survive, recovery can be slow and may involve neurological complications. It's important to note that these symptoms are quite distinct from those of COVID-19, which primarily affects the respiratory system. Let's take a moment to compare the symptoms of Nipah virus with those of COVID-19. As you can see, while there are some overlapping symptoms, the gastrointestinal and neurological involvement in Nipah virus is unique. These symptoms can be challenging to differentiate from other illnesses, which is why early diagnosis and isolation are crucial to preventing the spread of Nipah virus. In the next section, we'll discuss prevention strategies to protect yourself and your community from Nipah virus. Stay informed, stay vigilant, and don't forget to subscribe to our channel for more valuable insights. Here we delve into the critical topic of prevention and control of Nipah virus. Understanding these measures is essential to safeguard yourself and your community. First and foremost, personal hygiene is your frontline defense against Nipah virus. Proper hand washing with soap and water for at least 20 seconds is a must. Avoid close contact with animals, especially sick or dead ones. Nipah virus often originates from fruit bats and can be transmitted through their saliva and urine. When it comes to food safety, ensure that fruits and raw date palm sap are thoroughly washed and properly cooked before consumption. If you or someone you know is exhibiting symptoms of Nipah virus, it's crucial to isolate the individual and seek medical attention immediately. Isolation helps prevent further transmission. Healthcare workers should follow strict infection control measures, including wearing protective gear, when caring for Nipah virus patients. If you're traveling to regions where Nipah virus has been reported, take precautions like avoiding contact with sick individuals and consuming safe foods and beverages. Although there is currently no specific vaccine for Nipah virus approved for widespread use, researchers are actively working on it. Treatment options are primarily supportive care. During outbreaks, contact tracing plays a vital role in identifying and isolating potential cases. This helps contain the virus's spread. Public awareness campaigns are essential to educate communities about Nipah virus symptoms, prevention, and early reporting. Enhanced surveillance of animals, especially those that may carry the virus, is crucial to understanding and preventing Nipah virus spillovers. Preventing and controlling Nipah virus requires a multi-pronged approach, from personal hygiene to healthcare protocols and community engagement. Here we delve into the intriguing topic of immunity related to Nipah virus. Understanding the immune response is vital in our battle against this viral threat. The human immune system is a remarkable defense mechanism that plays a critical role in protecting us from infections. But how does it respond to Nipah virus? When Nipah virus enters the body, the immune system recognizes it as a threat. White blood cells, the body's soldiers, launch an attack. One key component of the immune response is the production of antibodies. These proteins target the virus, neutralizing it and preventing further infection. Cellular immunity also comes into play. Specialized cells, like T cells, hunt down and destroy virus-infected cells to limit the virus's spread. What's fascinating is that the immune system has a memory. If you survive a Nipah virus infection, your body will remember it. This may provide some level of immunity against future exposures. However, it's important to note that the extent and duration of immunity to Nipah virus are not fully understood. Reinfections are possible, although they are relatively rare. In communities where Nipah virus outbreaks have occurred, some level of herd immunity may develop over time. This means that a sufficient number of individuals become immune, reducing the virus's ability to spread. Vaccines are a promising avenue for enhancing immunity against Nipah virus. Researchers are actively working on vaccine candidates that could provide long-lasting protection. The scientific community continues to study Nipah virus immunity to better understand its dynamics and improve preventive measures. In summary, our immune system plays a crucial role in the fight against Nipah virus. While some immunity may develop after infection, the duration and effectiveness of this immunity are still subjects of ongoing research. In the upcoming sections, we'll explore historical Nipah virus outbreaks, their global impact, and the lessons we can learn from them. Here we take a closer look at Nipah virus outbreaks, their historical significance, and the global impact they've had. Nipah virus has been responsible for sporadic outbreaks since its discovery in the late 1990s. These outbreaks have been concentrated in specific regions. Outbreaks have occurred primarily in South and Southeast Asia, including countries like Malaysia, Bangladesh, and India. The impact of Nipah virus outbreaks on local communities has been profound. They have caused illness, death, and significant disruptions to daily life. Here we discuss the broader implications of Nipah virus and its role in the context of emerging diseases. Nipah virus is just one example of the many emerging diseases that have captured global attention in recent years. Several factors contribute to the emergence of diseases like Nipah virus, including deforestation, urbanization, and increased human-animal interactions. The emergence of new diseases underscores the critical need for preparedness at local, national, and international levels. Nipah virus, like other emerging diseases, has the potential to cause pandemics if not properly managed. The global response to COVID-19 has highlighted the importance of early detection, rapid response, and international cooperation in controlling pandemics. Nipah virus, with its zoonotic origins, reminds us of the complex dynamics between humans, animals, and the environment. Researchers are actively studying these dynamics to better predict and prevent future disease spillovers. Vaccine development for Nipah virus serves as a model for addressing emerging diseases. Enhancing global health security involves strengthening healthcare systems, surveillance networks, and research capabilities. In summary, Nipah virus is not just a single isolated threat. It's part of a broader context of emerging diseases that pose ongoing challenges to our global health. In this video, we've explored Nipah virus, its symptoms, prevention, immunity, historical outbreaks, and the broader implications it holds. Thank you for joining us on this journey of discovery and awareness. Don't forget to like, share, and subscribe to our channel for more insights into important topics like these. Regards, Dr. Lotta Bisht Grover.